Let me ask you a simple but powerful question. What if your body has been asking for help every single day and you just haven't been taught how to listen? Your kidneys are quiet workers. They don't shout. They don't demand attention. They sit in the background, filtering your blood, balancing fluids, removing toxins, protecting your heart, your bones, your brain. And they do this every minute of every day without applause, without complaint until they can. And here's the hard truth most people never hear. Kidney disease rarely starts with pain. It starts with signs, small changes, subtle signals, things we brush off as stress, aging, dehydration, or just life. And by the time pain shows up, the damage is often advanced. I've seen this too many times as a doctor. Good people, hard-working people, people who thought they were doing fine. They didn't ignore their kidneys on purpose. They just didn't know what to look for. Today, I want to change that because your body is incredibly intelligent. It always tries to warn you before something serious happens. The problem isn't that the body doesn't speak. It's that we're not taught its language, swollen ankles, puffy eyes, foamy urine, fatigue that sleep doesn't fix, dry, itchy skin, changes in urination, brain fog, shortness of breath, muscle cramps, poor appetite, metallic taste, nausea, back discomfort, dark urine, frequent nighttime urination, cold intolerance, easy bruising, persistent bad breath, high blood pressure that won't budge. These are not random. These are messages. And the good news, the hopeful news is this: the earlier you listen, the more power you have to slow, stop, and in many cases dramatically improve kidney health. This is not about fear. This is about awareness. This is about empowerment. Your kidneys are not fragile. They're resilient. They respond incredibly well when you remove what harms them and give them what they need. But they need you to notice the signs before it's too late. So today, I'm going to walk with you through 18 visible signs of kidney disease you should never ignore. Not to scare you, but to wake you up. Because knowledge isn't just power. Knowledge is prevention. Knowledge is freedom. And once you see these signs clearly, you can't unsee them. And that's where real change big in kidney disease is one of the most underdiagnosed, underdiscussed health issues in the world. Millions of people are walking around with declining kidney function and have no idea, and that matters because your kidneys influence almost every system in your body. When your kidneys struggle, toxins build up, fluid balance is disrupted, blood pressure rises, hormones that control red blood cells weaken, bones lose strength, the heart works harder, the brain becomes foggy, energy disappears. This isn't just about kidneys, this is about your entire life. What makes this especially important is that kidney disease doesn't usually announce itself with dramatic symptoms early on. It creeps in slowly, quietly, and that's why recognizing visible signs is so critical. These signs are your early warning system. Ignoring them doesn't make them go away. It just allows damage to continue silently. But here's the empowering part. Kidneys often improve when you change the environment they live in. Your diet, hydration, sleep, inflammation levels, blood sugar, blood pressure, and toxin exposure. You are not powerless here. When people understand what their body is telling them, they stop feeling confused and start making confident choices. They stop guessing. They stop reacting. They start leading their health. This matters for your family. This matters for your future. This matters for your independence, because kidney disease doesn't just affect how long you live. It affects how well you live. The earlier you act, the fewer medications you need, the less invasive the interventions, the more control you keep over your own body. This isn't about perfection, it's about paying attention. And once you know the signs, you can respond with simple, natural, daily habits that protect and support kidney function for years to come. Kidney disease rarely arrives suddenly. It develops quietly, patiently, often over years, and it leaves clues along the way. The problem is not that the body stays silent. The problem is that most people are never taught how to recognize what they are seeing. The earliest signs of kidney stress are visible, physical, and repeatable. And once you understand them, they become impossible to ignore. One of the most common signs is swelling, especially in the feet, ankles, legs, hands, and around the eyes. This happens because healthy kidneys remove excess fluid from the body. When they struggle, fluid begins to collect in the tissues. People often blame this on standing too long, hot weather, or aging, but persistent swelling is not normal. Puffy eyes in the morning or socks leaving deep marks at the end of the day are signals that your kidneys may not be keeping up with fluid balance. Changes in urine are another powerful message. Foamy or bubbly urine can indicate protein leaking into the urine, something that should never happen in large amounts. Dark, cloudy, or unusually strong smelling urine can reflect dehydration, toxin buildup, or impaired filtration. Urinating too often, especially at night, or not enough during the day can both point toward kidney stress. These patterns matter more than people realize because urine is the most direct window into kidney function. Fatigue that does not improve with rest is another red flag. When kidneys are underperforming, toxins remain in the bloodstream, and the production of erythropoietin, a hormone that helps create red blood cells, can drop. This leads to anemia, poor oxygen delivery, and deep exhaustion. People describe it as feeling drained, foggy, and weak even after a full night's sleep. This is not laziness or burnout, it is physiology. Skin changes also tell an important story. Dry, itchy skin can occur when minerals and nutrients become imbalanced and waste products accumulate in the blood. The skin becomes a secondary route of elimination, and irritation follows. Many people treat the symptom with creams and lotions, never realizing the root cause is internal. Muscle cramps, especially in the legs at night, often reflect electrolyte imbalances involving sodium, potassium, calcium, and magnesium, all tightly regulated by healthy kidneys. When this balance is disrupted, nerves and muscles misfire. These cramps are often dismissed as dehydration or aging, but recurring cramps deserve attention. Nausea, poor appetite, and a metallic taste in the mouth are signs of toxin buildup. When waste products linger in the blood, digestion suffers and food becomes less appealing. Bad breath that persists despite good oral hygiene can also come from this same process. As waste compounds are expelled through the lungs, shortness of breath may appear when fluid accumulates around the lungs or when anemia reduces oxygen delivery. Easy bruising can occur as platelet function and nutrient balance decline. Feeling unusually cold may be related to anemia and slowed metabolism. Persistent high blood pressure is both a cause and a consequence of kidney disease, creating a damaging feedback loop if not addressed. Each of these signs on its own may seem small. Together they form a clear pattern. These are not random annoyances. They are warnings. Your body is signaling that filtration, balance, and detoxification are under strain. The kidneys are asking for support, not silence. Recognizing these signs early is not about fear, it is about opportunity. The sooner you identify the problem, the more options you have. Awareness is the first act of self-respect, and listening to these signals is the beginning of protecting your long-term health. When kidney disease begins to affect daily life, it does so in ways that slowly shrink your world. At first, the changes are subtle. You wake up tired even after sleeping through the night. Your focus isn't what it used to be. Simple tasks feel heavier than they should. You push through, telling yourself this is just stress, just age, just life. But beneath the surface, your body is working harder and getting less done, and that effort comes at a cost. As kidney function declines, waste products that should be filtered out remain in the bloodstream. This creates a constant state of internal stress. The brain becomes foggy, reaction time slows, motivation drops. People often describe feeling disconnected from their own energy, like the spark they once had is dimmed. This affects work performance, relationships, and confidence. When your mind feels tired, everything else follows. Fluid imbalance begins to interfere with comfort and mobility. Swollen legs and feet can make walking uncomfortable and reduce physical activity. Puffy hands limit dexterity. Shortness of breath may appear with mild exertion, not because your lungs are weak, but because excess fluid and anemia are reducing oxygen delivery. As movement decreases, muscle mass declines, metabolism slows, and fatigue deepens, creating a downward spiral. Sleep quality also suffers. Frequent nighttime urination disrupts deep sleep cycles, leaving the body without adequate recovery time. Poor sleep worsens blood sugar control, increases inflammation, raises blood pressure, and weakens immune function. Over time, this compounds kidney stress even further. What began as a kidney issue now affects the entire system. Digestive health often deteriorates as well. Nausea, bloating, and loss of appetite reduce nutrient intake. When the body doesn't receive enough protein, iron, and essential minerals, muscle weakness and anemia worsen. Weight loss may occur not as a sign of health, but as a sign of breakdown. Food stops feeling nourishing and starts feeling burdensome. Long term, the consequences become more serious. Persistent high blood pressure damages blood vessels throughout the body, increasing the risk of heart attack and stroke. The heart works harder to pump against this resistance, leading to thickened heart muscle and reduced efficiency. Kidney disease and heart disease move together, accelerating each other in a dangerous cycle. Bone health is another silent casualty. Healthy kidneys activate vitamin D and regulate calcium and phosphorus balance. When this system fails, bones lose density and strength, fracture risk increases, posture changes, chronic pain becomes more common. What many people assume is normal aging is often mineral imbalance driven by declining kidney function. Anemia becomes more pronounced over time, reducing endurance and resilience. People feel cold more easily, bruise more often, and recover more slowly from illness or injury. The immune system weakens, increasing susceptibility to infections. Healing slows, independence begins to slip away. In advanced stages, daily life becomes organized around symptoms and treatments rather than goals and passions. Medical appointments increase, medications multiply, dietary restrictions tighten, energy becomes something to manage rather than something to enjoy. This is not just a physical burden, it is an emotional one. Anxiety, frustration, and hopelessness can take hold when people feel their body is no longer on their side. But this progression is not inevitable. The impact on daily life and long-term health depends heavily on how early the problem is recognized and how decisively it is addressed. Kidney disease is a condition where timing matters. Early action preserves freedom, delayed action limits options. Understanding how kidney disease affects the whole body reframes the urgency. This is not about avoiding a diagnosis. It is about protecting your energy, your mobility, your clarity, and your independence. The kidneys may be small organs, but their influence is enormous, and caring for them is an investment in every part of your future. Kidney disease does not begin with a dramatic collapse. It begins with small, visible signals that most people are taught to overlook. The body is always communicating, always adjusting, always trying to protect itself. And when the kidneys come under stress, that communication shows up in ways you can see, feel, and experience every day. The challenge is that these signs often seem unrelated, mild, or easy to explain away, which allows the underlying problem to continue unchecked. One of the clearest indicators is swelling in the body, particularly in the feet, ankles, legs, hands, and around the eyes. Healthy kidneys maintain precise fluid balance by removing excess water and sodium. When they struggle, fluid escapes into surrounding tissues. This swelling may appear gradually, worsening by the end of the day, or showing up as puffiness in the face each morning. Many people blame this on heat, long hours of standing, or poor circulation, but ongoing swelling is not normal and should never be ignored. Urine changes provide some of the most direct evidence of kidney stress. Foamy urine, especially if it persists, often means protein is leaking through damaged filters. Dark, cloudy, or unusually concentrated urine can reflect poor filtration or dehydration linked to kidney dysfunction. Changes in frequency matter just as much. Urinating far more often, particularly at night, or producing very little urine despite adequate fluid intake are both warning signs that the kidneys are struggling to regulate output. Fatigue is another major signal. This is not ordinary tiredness that improves with rest. Kidney-related fatigue feels deep and persistent. When the kidneys fail to remove toxins efficiently, those waste products circulate in the bloodstream, affecting brain function and energy levels. At the same time, reduced production of red blood cells limits oxygen delivery to tissues. The result is exhaustion, weakness, and mental fog that can make even simple tasks feel overwhelming. Skin often reveals internal imbalance. Persistent itching or dryness can occur when waste products accumulate in the blood and mineral balance is disrupted. The skin becomes irritated as the body attempts to compensate for reduced filtration. Many people focus only on external treatments, not realizing the issue begins internally. Muscle cramps, especially in the legs and feet, frequently reflect electrolyte imbalance. The kidneys tightly regulate sodium, potassium, calcium, and magnesium. When this regulation falters, nerves and muscles misfire, causing painful cramping, often at night. These episodes are often dismissed as dehydration or aging, but when they recur, they are worth serious attention. Digestive symptoms are also common. Nausea, poor appetite, and a metallic taste in the mouth develop as toxins build up. Food becomes less appealing, not because the body doesn't need nourishment, but because waste products interfere with normal digestive signaling. Persistent Add breath can emerge for the same reason, even with good oral hygiene. Breathing changes may appear as well. Shortness of breath can occur due to fluid accumulation or anemia. Feeling cold more often than usual may reflect reduced red blood cell production and slower metabolism. Easy bruising can signal platelet dysfunction and nutrient imbalance. High blood pressure deserves special attention because it is both a cause and a consequence of kidney disease. Damaged kidneys struggle to regulate pressure, and elevated pressure further injures delicate kidney filters. This cycle often progresses silently unless actively interrupted. None of these signs exist in isolation. They form a pattern. Each one is a message that filtration, balance, and detoxification are under strain. Recognizing these signs early is not about panic or fear. It is about awareness. The body is asking for support long before irreversible damage occurs. Listening to these visible signals is one of the most powerful acts of self-care you can make, because early recognition creates the opportunity to protect kidney function and preserve long-term health. The most powerful changes you can make for kidney health are often the simplest ones, and they start with paying closer attention to your daily patterns. You don't need complicated programs or extreme interventions. You need awareness, consistency, and a willingness to respond to what your body is telling you. Practical action begins with observation. Notice your urine every day. Its color should be pale yellow, not dark, cloudy, or persistently foamy. Pay attention to how often you urinate and whether you wake at night to go. These small details offer real-time feedback about hydration and kidney function. Hydration is foundational, but it's not about forcing excessive water intake. It's about steady, consistent hydration throughout the day. Drink when you're thirsty and aim for clean, simple fluids. Avoid sugary drinks, artificial sweeteners, and excessive caffeine, all of which place extra strain on the kidneys. Start your morning with water before coffee or tea. This simple habit alone can improve circulation and filtration. Food choices matter immediately. Focus on whole, unprocessed foods that reduce inflammation and stabilize blood sugar. Highly processed foods, especially those high in refined carbohydrates, seed oils, and additives, increase kidney workload. Reduce packaged foods and restaurant meals where sodium is hidden and excessive. Instead of fearing salt from real food, eliminate the salt that comes from processed products. This single shift can dramatically reduce fluid retention and blood pressure. Protein intake should be thoughtful, not extreme. The kidneys process protein waste, so wildly fluctuating or excessive intake can be stressful. Choose high-quality protein sources and eat them consistently rather than sporadically. Balance matters more than restriction. Movement is another practical tool. Daily walking improves circulation, blood pressure, insulin sensitivity, and lymphatic flow, all of which support kidney function. You don't need intense exercise. A 20 to 30-minute walk after meals can significantly improve metabolic health. Gentle movement also helps reduce swelling in the legs and improves sleep quality. Sleep is not optional for kidney repair. Poor sleep raises stress hormones, increases inflammation, and worsens blood pressure and blood sugar control. Set a consistent sleep schedule, reduce screen exposure at night, aim for deep, uninterrupted rest. Even improving sleep by 1 hour per night can have measurable benefits. Be cautious with medications and supplements. Over-the-counter painkillers, especially frequent use of NSAIDs, are a common and often overlooked cause of kidney injury. Use them sparingly and only when truly necessary. Avoid unnecessary supplements that place detox demands on the kidneys without clear benefit. Stress management is often ignored, but it matters deeply. Chronic stress raises cortisol and blood pressure, both of which harm kidney filters over time. Simple breathing exercises, time outdoors, and moments of quiet can lower nervous system strain. You don't need perfection. You need regular moments of calm. Leg elevation is a simple technique for managing swelling. Elevate your feet above heart level for short periods during the day to help fluid return to circulation. Compression socks may help some people, but addressing the root causes through hydration, movement, and diet is more effective long term. Regular monitoring is empowering. Track blood pressure at home. Notice trends rather than single readings. Get routine blood and urine tests when appropriate. Knowledge reduces fear and improves decision making. Every one of these steps is available today. None require waiting, approval, or dramatic life changes. When practiced consistently, they create an environment where the kidneys can recover and function more efficiently. Small daily actions, repeated over time, build protection, resilience, and long-term health. Long-term kidney health is not built through short bursts of effort or occasional motivation. It is built through habits that become part of your identity and daily rhythm. The kidneys respond to what you do most often, not what you do once in a while. This is why consistency matters more than intensity. Small, repeatable actions send powerful signals of safety and stability to the body, allowing healing and protection to take place over time. One of the most important consistent habits is regular hydration, not sporadic, not extreme, but steady. Drinking adequate water day after day helps. Maintain blood volume, supports filtration, and prevents concentrated waste from stressing kidney tissue. When hydration becomes routine, the kidneys no longer need to compensate, and this reduces long-term wear. Food patterns shape kidney health more than isolated meals. Eating mostly whole, minimally processed foods reduces inflammatory burden and supports blood sugar balance. When blood sugar remains stable, the kidneys are protected from glycation damage that weakens delicate filtering units. Consistency in food choices also stabilizes electrolytes, which reduces cramps, swelling, and fatigue. Blood pressure control is another daily practice, not a one-time goal. Chronic elevation damages kidney blood vessels over years. Consistent movement, proper sleep, stress reduction, and thoughtful sodium intake gradually lower pressure in a sustainable way. This protects both the kidneys and the heart, preserving long-term function. Sleep is where repair happens. Going to bed and waking up at similar times each day strengthens circadian rhythm, improves hormone balance, and reduces inflammation. Over time, better sleep improves insulin sensitivity and blood pressure, two of the strongest drivers of kidney damage when left unchecked. Consistent sleep is one of the most underrated kidney protective habits. Movement should be predictable, not punishing. Daily walking, light strength work, and gentle stretching improve circulation and metabolic health. Consistent activity keeps muscles active, reduces insulin resistance, and improves lymphatic flow, all of which reduce kidney strain. Skipping movement for days or weeks and then trying to catch up with intense exercise creates stress rather than benefit. Stress management works the same way. Occasional relaxation cannot counter chronic stress. Building small daily practices like deep breathing, quiet reflection, time in nature, or brief digital breaks trains the nervous system to downshift. Over time, cortisol levels fall, blood pressure stabilizes, and kidney filters are exposed to less hormonal strain. Medication awareness is also a habit. Avoiding frequent use of kidney-stressing drugs requires daily mindfulness. Reading labels, asking questions, and choosing non-drug strategies for pain and inflammation become protective behaviors when practiced consistently. Regular self-checks reinforce awareness. Noticing urine color, swelling, energy levels, and blood pressure trends helps catch changes early. This ongoing feedback loop allows adjustments before damage accumulates. Consistency here creates confidence rather than anxiety. Perhaps most importantly, consistent habits build trust between you and your body. When your body experiences predictable care, it shifts from survival mode to repair mode. Healing is not rushed. It unfolds when the environment is supportive and stable. Kidney health is not about restriction or fear. It is about alignment. When daily habits align with biological needs, the kidneys function with less effort and greater resilience. Over months and years, these small, repeated choices preserve independence, energy, and quality of life. Consistency is not glamorous, but it is powerful, and it is the foundation of lasting kidney protection. The most important shift you can make when it comes to kidney health is how you interpret the signs your body gives you. Too often, people see symptoms as enemies, problems to suppress, silence, or ignore. But the truth is, your body is always on your side. Every signal is an attempt to protect you, to adapt, to survive. Kidney-related symptoms are not punishments, they are messages, and when you understand that everything changes, the kidneys are remarkably resilient organs. They are designed with excess capacity, able to function well even when part of their workload is compromised. This is why kidney disease can progress silently for so long, but that resilience is also hopeful. It means that when you intervene early, when you reduce the burden placed on them, improvement is not only possible, it is common. The motivational takeaway is this: you are not broken and you are not behind. Wherever you are right now is simply the point where awareness has arrived. The body does not hold grudges, it responds to what you do next. When people understand this, fear gives way to agency. Instead of asking, how bad is it? The better question becomes, what can I do today to support my body? Every positive change counts. Drinking water instead of soda, walking instead of sitting, choosing real food instead of packaged food, sleeping an hour earlier, taking a few deep breaths when stress rises. None of these actions seem dramatic, but the body experiences them as safety. Over time, safety allows repair. Motivation doesn't come from pressure, it comes from purpose. Protecting your kidneys is not just about avoiding disease, it's about preserving energy, clarity, and independence. It's about being able to show up for your family, your work, and your life with strength and focus. When people connect kidney health to the life they want to live, consistency becomes easier. Progress is not linear. There will be good days and off days. The key is to keep returning to supportive habits without self-judgment. Guilt raises stress. Stress harms the kidneys. Compassion lowers stress. Compassion heals. Treating yourself with patience is not weakness. It is strategy. Another powerful motivator is remembering that early action multiplies options. The earlier you respond to warning signs, the more freedom you preserve. You reduce the need for medications, procedures, and restrictions. You stay in control. This is not about waiting for perfect motivation. It is about acting before urgency forces your hand. Your body keeps records every night of good sleep. Every balanced meal, every calm breath leaves a biological imprint. Over weeks and months, those imprints accumulate. Blood pressure improves, energy returns, swelling decreases, clarity sharpens. These small wins reinforce belief, and belief fuels momentum. The most inspiring truth is that your kidneys want to heal. They are not passive victims. They are adaptive, responsive, and hardworking. When you reduce inflammation, stabilize blood sugar, manage blood pressure, and lower toxin exposure, they respond. So let this be the takeaway that stays with you. Listen early, respond gently, and act consistently. You do not need to be perfect. You need to be present. The path forward is not overwhelming when you take it one step at a time. And every step you take toward supporting your kidneys is a step toward a stronger, freer future. Listen to your body, especially when it whispers. Notice the signs, respect the warnings, and choose today to protect the organs that protect you. Your future self is depending on the choices you make right now.